So one recent question that we've gotten is, will skills tell me exactly what to do with my child? So this is a good question. A lot of parents want to know if it's going to tell them exactly step by step what to do. And it's kind of a long answer.
Okay.
But basically, the first answer to the question is that in order to use skills, because skills is a curriculum, they need to have training in how to teach children with autism things. And skills can be used with any teaching paradigm. It doesn't have to be ABA. So if people have other kind of methods that they prefer to use, that's fine, and they could still use skills as a curriculum. Mm-hmm. But they at least need to have what teaching method are they going to be using. If it's ABA that they want to use, and they don't know how to do ABA-based intervention, then there's definitely places they can go to get that information. Institute for Behavioral Training, which their web address is ibehavioraltraining.com. If they go there and click on e-learning, they can actually take a bunch of courses to learn, and it's all online, very easy to do anywhere.
Very inexpensive too.
Yeah.
Amazingly inexpensive.
Yeah. And it teaches them basically how to implement ABA-based procedures and techniques for teaching skills and for dealing with challenging behavior.
Okay.
But the thing is once someone's trained in all of that, that doesn't mean they know what to teach a child, right? So they don't necessarily know what's age appropriate for their child, what their individual child's deficits are, that they should focus on, and all these other things. That's what the point of skills is. So skills is a curriculum that once you have your background knowledge on how to teach, you begin to use skills to figure out what to teach.
Okay.
So how to teach versus what to teach. How to teach needs to be in place before you're using skills. Okay? All right, then once using skills, it does provide it's step-by-step in terms of within the lessons. All the lessons have activities that are numbered, so you can follow that order if you want. It's not required, though. You're going to find some activities when you read them, you think this isn't going to really be relevant to my child in their life, so why waste time teaching it? We're not going to dictate you have to follow a certain order.
Right.
But the way skills works is that you answer assessment questions, and based on how you answer them, you get access to certain activities that you can choose to put into your child's treatment plan. Now, there's a lot of activities in the skills program. There's 4,000 or so.
Yeah.
So if you find a lot of things your child can't do, you're going to have a lot of options. That's where I think sometimes parents get a little bit confused, because they say, like, there's so many options, I don't know which ones to do, and I thought skills was going to tell me the 10 or 15 that I should be doing. Mm-hmm. So we do have quite a few tools in place to help people to decide which ones to teach. But the reason that we don't just say, here's the 15 you should do, is because there's too many other variables involved in deciding that.
Yeah.
For instance, how many hours a week are you going to be doing with the child? How long does the, if they're getting ABA, let's say, through a consultant or something that you're paying, how long do you have access to that person? Is it for 6 months, or is it for however long you want? Is it a couple of years? You know, those kind of things. Your whole goals on what you're going to work on is going to shift based on these kind of things. What are your resources? What's relevant to the child's real life and will actually be maintained in those settings?
Yeah.
What does the teacher want? What do you want as a parent? Skills cannot figure out all those things, and so we're not going to say, here's the 15 things that you need to do.
Yeah.
Instead, we say, here's all the things your child needs to learn. Okay? And then we provide 5 tools to help you pick which ones of those you want to introduce. So every lesson's in a level. Start with lower levels. Every activity has an age associated with it. Mm-hmm. You may want to start with the younger things first to fill in those gaps. All the activities are numbered, so if you definitely know you want to teach a certain lesson area, you can follow the order. And all of the activities have prerequisites listed, so that means check those out first. And then the 5th thing is all the activities have a certain type of label, or they're a certain type. So they're either a fundamental skill, which is like a milestone or real skill children engage in daily life, or they're a building block, which is not a real skill. It's more like, here's the real skill, but some kids can't just go straight there. So we broke it down first, and we're going to teach these little steps before we get to the real skill.
Right.
And then we have what's called an expansion skill that goes above and beyond a fundamental. It's like an enrichment activity, not necessary for every single child. So look at your child and ask yourself, what kind of learner is my child? Does my child fly through this curriculum really fast and learn really quickly? If so, I might not need building blocks, because they're not the real skill anyways, and they're really just there to help kids get to the fundamental. I could maybe skip straight into fundamentals and work on expansions. Versus if I have a different opposite kind of child, I might actually really need those building blocks. Fundamentals will be important, and maybe I just don't have time to worry about enrichment. I need to just get with all the functional skills and move on quickly. So those are the tools we provide to help people decide what to introduce. And then once you're in the activities themselves, yeah, it's very clear what you're teaching, and there's plenty of teaching points and hints and things like that to help you along the way.
Absolutely.
So that's my really long, drawn-out answer to that question, but it's hard for parents that are just kind of stepping out there.
But there's a lot of support.
Yeah. That's a good point. We offer consultation, and one of our consultants can meet with parents for however many hours a month they want to do it. And they can do video conferencing and phone conferencing and walk them through using skills and help them choose what they're going to work on and all those kind of things. That's an additional thing we can provide. It's an additional fee, but for free what we can provide is we have constant live chatting, and we can do emails and phone calls. So.
And it's remarkable. I just have to say it's remarkable, and I do use it at home. It's remarkable. So I encourage you to check it out, and they can do a free trial.
Yes, there's always a 14-day free trial that you can just get right online at the website.